Well, we understand that extreme heat is bad for our physical health, but often we overlook the toll that heat takes on our mental health. Studies show that rising temperatures are exacerbating anxiety, depression, and rare conditions like schizophrenia. But for more on this, let's speak to Dr. Vivek Shandas, founder and director of Sustaining Urban Places Research at Portland State University. Dr. Shandas, thank you so much for joining us. Now, let's begin off by asking, when we think about hotter weather, especially here in Singapore, we don't immediately think about the impact on mental well-being. How concerned should we be about the impact of rising temperatures on our mental health?
Right. So we hear a lot, as you noted, about the physical implications of extreme heat. It affects our cardiovascular system, it affects our respiratory system, it affects blood pressure, those who have pre-existing health conditions or have take specific medications can really be affected, though this has a direct effect on our mental health as well. In large part, it really comes down to a set of direct effects and a set of indirect effects is really what I look at it as. And the direct effects have a lot to do with our ability to really cope with that extreme heat. When it gets hot, our bodies actually start shifting physiologically, and the blood and the circulation system actually starts affecting hormonal shifts in our body, and that starts to affect how we feel. And so when our emotions are then affected through hormonal and various other systems that are implicated, we start to actually change from feeling potentially happy and well to feeling a lot more concerned and anxious. And these are well-established direct implications of heat. It's not something that's recent. Humans have been experiencing this for a very long time. And as temperatures continue to rise, we'll start seeing a lot more effects on mental health.
Well then, Dr. Shandas, what can be done? You see, heat waves are becoming really common and they are hotter and lasting even longer. So what can we do to protect ourselves? Because staying indoors can also negatively impact our mental health, isn't it?
Yes, right. So as we learned from the pandemic, from a lot of isolation, when it's hot, what humans do is generally go inside. And when we spend time inside, we end up isolating a lot more from our friends, family, and neighbors. And that lack of social interaction is an indirect effect on our mental health and well-being. And so part of the challenge with heat is that getting outside and doing anything, whether you have your own car and have access to it, or you take public transit, you have to, in many cases, go outside and bear the brunt of that extreme heat. So partly what a lot of people who are involved in the mental health response to extreme heat are recommending now is to really take a few different precautionary measures. The first is to prepare. That's before the heat wave arrives, to be able to check in with your friends, family, and neighbors and see who is available, who might be available to help you if you need help, and also to be able to see if they are available for you to be able to stay in touch with when the heat wave comes through. If it's a consistent, ongoing, long-term heat impact, what we really want to do is start taking other precautionary measures when the heat arrives. So we really want to stay in touch with our friends and family and neighbors. Those tend to be the closest network. And we know that people are more resilient when they have these social networks. We know that it helps we know that it helps our mental health. We know that isolation only further exacerbates mental health challenges. And so part of it is really being able to check in on your neighbors. If you're healthy and well, check on the people that are older or may have some known health conditions that you would be able to make sure they're doing well during the heat wave. So this social bonding is really one of the critical aspects that humans need to be thinking about when it gets hot. And many places like across Asia, where much of my family lives, tend to look to each other for help during these acute and difficult times, including times when extreme heat becomes present. Places like the United States, I've seen a lot more isolation and people becoming a lot more lonely and depressed and anxious during extreme heat. So we need to really be learning from each other about what works during these extreme climate-induced events and finding those things that are culturally relevant to each of the places that we live and what will work and what might be more challenging to manage our mental health.
Picking up on the point that you said, when it's very hot, it can have an impact on the mood of people. I was just reading up an article prior to our interview, and one of it says that, being in a very hot and uncomfortable situation can really affect a person's mood. In fact, research shows that people are more likely to even tweet more negatively being in a very hot and heated environment. So in such cases and instances, how then can we better mitigate or take steps to handle our mood, our behavior better?
Yes, so we actually have a relatively large body of evidence that shows that when temperatures do get hot, there is greater number of accidents that happen on the roads. There's a greater number of hospitalizations. There are greater severity of judges and the kind of punishments that judges deliver during extremely hot periods. We have lots of evidence about the social implications of extreme heat. We see a lot more aggression. We see a lot more domestic violence. All these things are very well established, and it's nothing new in this field of extreme heat and human behavior. What we can do to really think through and address this is really to work with individuals as well as the systems that we have in place. I work with a group of community health workers. Those are people who go and check in on their clients and potentially vulnerable communities and ensure that during these times when we have predicted extreme heat, that they are being taken care of, that they have resources, that they're able to talk and actually work through some of these anxieties and difficulties that they may be feeling when the temperature reaches 36, 40, 44 Celsius. And those are very real and very concerning challenges that communities face. And having community health workers directly engage with people is a systemic approach that we all need to be thinking about. Individually, we can all become a lot more mindful about how we are experiencing this heat, slowing down, becoming much more quiet, becoming much more able to have gentle interactions with ourselves and engaging in things like journaling or things like talking to friends, families, trusted neighbors that you have. These are all things we can start to do a lot more consciously and mindfully to be able to reduce the acute effects of heat. We really need to turn the dial down on our temperament, on our response, our emotional response to events that are happening around the world and near us.
Well, thank you very much for sharing your insights with us. Dr. Vivek Shandas, founder and director of Sustaining Urban Places Research at Portland State University.